Coronary artery disease is a condition in which the arteries that supply blood to the heart muscle become narrowed or blocked. These arteries are called coronary arteries, and their job is to deliver oxygen-rich blood so the heart can pump effectively. The disease develops gradually, usually over many years. The primary cause of coronary artery disease is a process called atherosclerosis. This occurs when fatty substances, cholesterol, calcium, and inflammatory cells accumulate along the inner walls of the arteries. These buildups form plaques. As plaques grow, they reduce the space inside the artery, limiting how much blood can flow through. The artery also becomes less flexible, making it harder to respond to changes in blood demand. When blood flow is reduced, the heart muscle may not receive enough oxygen, especially during physical activity or stress. This lack of oxygen is called ischemia. Ischemia commonly causes chest pain or pressure known as angina. If a plaque ruptures, a blood clot can form suddenly and completely block the artery. When this happens, part of the heart muscle is deprived of blood and begins to die, resulting in a heart attack. Risk factors include high blood pressure, high cholesterol, smoking, diabetes, obesity, physical inactivity, and long-term stress. Heart failure is a condition in which the heart is unable to pump enough blood to meet the body's needs. It does not mean the heart has stopped working, but that its pumping ability has become weakened or inefficient. The problem can affect the left side of the heart, the right side, or both. There are two main types of heart failure based on how the heart is affected. In systolic heart failure, the heart muscle becomes weak and cannot contract forcefully enough to push blood forward. In diastolic heart failure, the heart muscle becomes stiff and cannot relax properly, which prevents the chambers from filling with enough blood between beats. In both cases, less blood is delivered to organs and tissues. When the heart cannot pump effectively, blood begins to back up in the circulatory system. This backup increases pressure in blood vessels and forces fluid out into surrounding tissues. Fluid buildup in the lungs causes shortness of breath, especially during activity or while lying down. Fluid buildup in the legs, ankles, and abdomen causes swelling. Heart failure often develops as a result of other cardiovascular conditions, including coronary artery disease, heart attacks, high blood pressure, cardiomyopathy, and valve disease. Over time, the heart compensates by enlarging or beating faster, but these adaptations eventually worsen the condition rather than fix it. A myocardial infarction, commonly known as a heart attack, occurs when blood flow to a portion of the heart muscle is suddenly and severely reduced or completely blocked. This interruption prevents oxygen from reaching heart tissue, causing muscle cells to begin dying within minutes. The longer the blockage lasts, the greater the permanent damage to the heart. Most heart attacks are caused by coronary artery disease. Plaque buildup inside a coronary artery can rupture, exposing its contents to the bloodstream. This triggers the formation of a blood clot. If the clot grows large enough, it can fully obstruct the artery. Without oxygen, the affected section of heart muscle cannot produce energy and rapidly loses function. Symptoms of a heart attack vary, but often include chest pain or pressure that may spread to the arms, neck, jaw, or back. Other symptoms can include shortness of breath, nausea, sweating, dizziness, and extreme fatigue. Some heart attacks occur with mild or unusual symptoms, particularly in older adults and people with diabetes. When heart muscle tissue dies, it is replaced by scar tissue. Scar tissue does not contract like healthy muscle, reducing the heart's overall pumping ability. This can lead to complications such as heart failure, dangerous heart rhythm, disturbances, or sudden cardiac death, depending on the size and location of the damage. Atrial fibrillation is a heart rhythm disorder in which the upper chambers of the heart, called the atria, beat in a rapid, irregular, and uncoordinated manner. Instead of contracting in a steady rhythm to move blood efficiently into the lower chambers, the atria quiver. This disrupts normal blood flow through the heart. Under normal conditions, the heart's rhythm is controlled by organized electrical signals that begin in a specific area of the right atrium. In atrial fibrillation, these electrical signals become chaotic and fire from multiple locations at the same time. As a result, the atria lose their ability to contract effectively. Blood is no longer fully pushed into the ventricles with each heartbeat. Because blood lingers in the atria, it can pool and form clots. If a clot breaks free, it can travel through the bloodstream to the brain and block an artery, causing a stroke. This makes atrial fibrillation one of the strongest risk factors for stroke, even when other symptoms are mild. Atrial fibrillation can be triggered by high blood pressure, coronary artery disease, heart valve disorders, heart failure, lung disease, thyroid disorders, and aging. Some people experience palpitations, shortness of breath, fatigue, or dizziness, while others may have no noticeable symptoms and remain unaware of the condition until complications develop. Cardiac arrhythmias are disorders in which the heart beats too fast, too slow, or in an irregular pattern due to problems with its electrical signaling system. These electrical signals normally follow a precise pathway that controls the timing and coordination of each heartbeat. When this system is disrupted, the heart's rhythm becomes abnormal. Arrhythmias are broadly classified by whether they originate in the upper chambers of the heart, called supraventricular arrhythmias, or in the lower chambers, called ventricular arrhythmias. Supraventricular arrhythmias include conditions such as supraventricular tachycardia, where the heart suddenly beats very fast, and atrial flutter, where the atria beat rapidly, but in a more organized pattern than atrial fibrillation. These rhythms can reduce the heart's efficiency, but are often less immediately life-threatening. Ventricular arrhythmias affect the heart's main pumping chambers and are more dangerous. Ventricular tachycardia causes the ventricles to beat so fast that they cannot fill properly with blood. Ventricular fibrillation causes completely disorganized electrical activity, preventing the heart from pumping at all. Without immediate treatment, ventricular fibrillation leads to sudden cardiac death. Arrhythmias can be caused by heart disease, prior heart attacks, electrolyte imbalances, medication effects, genetic conditions, or damage to heart tissue. Symptoms range from palpitations and lightheadedness to fainting or sudden collapse, depending on the type and severity of the rhythm disturbance. Hypertension is a condition in which the force of blood pushing against the walls of the arteries remains consistently too high. Blood pressure is determined by how much blood the heart pumps and how much resistance the blood encounters as it flows through blood vessels. When arteries become narrow, stiff, or less elastic, resistance increases and blood pressure rises. In many people, hypertension develops slowly and produces no noticeable symptoms. Despite the lack of symptoms, elevated pressure places constant strain on the cardiovascular system. Over time, this strain damages the inner lining of arteries, making them more vulnerable to plaque buildup. This accelerates atherosclerosis and increases the risk of coronary artery disease, heart attacks, and strokes. High blood pressure also forces the heart to work harder to push blood through the body. To compensate, the heart muscle thickens, particularly the left ventricle. While this initially helps maintain circulation, the thickened muscle becomes stiff and less efficient. This can eventually lead to heart failure. Hypertension affects blood vessels throughout the body, not just the heart. It can damage the kidneys by impairing their ability to filter blood, harm the eyes by damaging delicate blood vessels in the retina, and weaken arteries in the brain, increasing the risk of stroke and cognitive decline. Common contributing factors include excess sodium intake, obesity, physical inactivity, chronic stress, genetic predisposition, kidney disease, and hormonal disorders. Atherosclerosis is a disease in which arteries become narrowed and hardened due to the buildup of fatty deposits along their inner walls. These deposits, called plaques, are made up of cholesterol, fats, calcium, and inflammatory cells. The process begins when the inner lining of an artery becomes damaged, allowing these substances to accumulate over time. As plaques grow, they reduce the amount of space available for blood to flow through the artery. This restricts oxygen and nutrient delivery to organs and tissues. The affected artery also becomes stiff and less able to expand or contract in response to changes in blood demand. This loss of flexibility increases blood pressure and places additional strain on the heart. Atherosclerosis often develops silently for decades before causing symptoms. The effects depend on which arteries are involved. When it affects coronary arteries, it leads to coronary artery disease and angina. When it affects arteries supplying the brain, it increases the risk of stroke. In peripheral arteries, it causes peripheral artery disease, leading to pain, weakness, or poor wound, healing in the limbs. Plaques can also become unstable and rupture. When this happens, the body responds by forming a blood clot at the site of the rupture. A clot can partially or completely block the artery, abruptly stopping blood flow. This sudden blockage is a common cause of heart attacks and ischemic strokes. Risk factors include high cholesterol, smoking, high blood pressure, diabetes, obesity, and chronic inflammation. A stroke occurs when blood flow to part of the brain is interrupted, depriving brain cells of oxygen and nutrients. Brain tissue is highly sensitive to oxygen loss, and damage can begin within minutes. The effects of a stroke depend on the location and extent of the affected brain area. There are two main types of stroke: ischemic and hemorrhagic. Ischemic strokes are the most common and occur when a blood vessel supplying the brain becomes blocked. The blockage is usually caused by a blood clot that forms in an artery narrowed by atherosclerosis or travels from another part of the body, often the heart. Atrial fibrillation is a major source of these traveling clots. Hemorrhagic strokes occur when a blood vessel in the brain ruptures and bleeds into surrounding tissue. This bleeding increases pressure inside the skull and damages brain cells directly. Common causes include uncontrolled high blood pressure, weakened blood vessel walls, and aneurysms. When blood flow is disrupted, brain cells cannot produce energy and begin to fail. This leads to sudden symptoms such as weakness on one side of the body, difficulty speaking, vision loss, confusion, or loss of coordination. Some strokes cause permanent disability, while others are fatal, depending on how quickly blood flow is restored and how much brain tissue is damaged. Stroke is closely linked to cardiovascular disease because conditions such as hypertension, atherosclerosis, heart disease, and arrhythmias significantly increase stroke risk. Peripheral artery disease is a condition in which arteries that supply blood to the limbs, most commonly the legs, become narrowed or blocked. The underlying cause is usually atherosclerosis, the same plaque-building process that affects coronary arteries. As plaque accumulates, blood flow to muscles and tissues in the extremities is reduced. When leg muscles do not receive enough oxygen-rich blood, especially during physical activity, pain or cramping can occur. This symptom is called claudication. Claudication typically appears during walking or exercise and improves with rest because resting lowers the muscle's demand for oxygen. As the disease progresses, pain may occur even at rest. Reduced blood flow also interferes with the body's ability to heal. Cuts, sores, or ulcers on the feet and legs may heal slowly or not at all. In severe cases, tissue can begin to die, a condition known as gangrene. This can lead to serious infections and may require amputation if blood flow is not restored. Peripheral artery disease is an indicator of widespread vascular disease. People with PAD often have atherosclerosis in other parts of the body, including the heart and brain. This significantly increases the risk of heart attack and stroke, even if leg symptoms are mild. Risk factors include smoking, diabetes, high blood pressure, high cholesterol, obesity, and aging. Cardiomyopathy is a group of diseases that affect the heart muscle itself, reducing the heart's ability to pump blood effectively. Unlike conditions caused by blocked arteries or faulty valves, cardiomyopathy primarily involves changes in the structure and function of the heart muscle. There are several major types of cardiomyopathy. Dilated cardiomyopathy occurs when the heart chambers enlarge and the muscle walls become thin and weak. This reduces the force of contraction and leads to poor blood circulation. Hypertrophic cardiomyopathy involves abnormal thickening of the heart muscle, most often the wall between the ventricles. The thickened muscle can obstruct blood flow and interfere with normal heart relaxation. Restrictive cardiomyopathy occurs when the heart muscle becomes stiff and less flexible, preventing proper filling of the chambers between beats. As cardiomyopathy progresses, the heart struggles to maintain adequate blood flow. This can cause symptoms such as fatigue, shortness of breath, swelling in the legs or abdomen, dizziness, and chest discomfort. Abnormal heart rhythms are also common because damaged muscle disrupts the heart's electrical system. Cardiomyopathy can be caused by genetic mutations, long-term high blood pressure, heart attacks, viral infections, alcohol abuse, certain medications, and metabolic disorders. Over time, the condition can lead to heart failure, blood clots, or sudden cardiac arrest. Valvular heart disease occurs when one or more of the heart's valves do not open or close properly. The heart has 4 valves that regulate blood flow between its chambers and into the major arteries. These valves ensure that blood moves forward in the correct direction with each heartbeat. Valve problems generally fall into 2 categories: stenosis and regurgitation. Stenosis occurs when a valve becomes stiff, thickened, or fused, limiting how widely it can open. This restricts blood flow and forces the heart to pump harder to move blood through the narrowed opening. Regurgitation occurs when a valve fails to close completely, allowing blood to leak backward into the chamber it just left. Over time, abnormal valve function disrupts normal circulation. The heart may enlarge or thicken in response to the increased workload. These changes initially help maintain blood flow, but eventually weaken the heart and reduce pumping efficiency. Symptoms can include shortness of breath, fatigue, chest pain, dizziness, and swelling in the legs or abdomen. Valvular heart disease can be caused by congenital defects, age-related degeneration, infections such as rheumatic fever or endocarditis, prior heart attacks, or connective tissue disorders. The severity of the condition varies widely. Mild valve disease may cause few symptoms, while severe valve dysfunction can lead to heart failure, dangerous arrhythmias, or sudden cardiacs complications if left untreated. Congenital heart disease refers to structural problems of the heart that are present at birth. These defects develop while the heart is forming during early pregnancy and affect how blood flows through the heart and to the rest of the body. The severity ranges from mild abnormalities that cause few symptoms to complex defects that require multiple medical interventions. Some congenital heart defects involve holes in the walls that separate the heart chambers. These openings allow oxygen-rich and oxygen-poor blood to mix, reducing the efficiency of circulation. Other defects affect the heart valves, causing them to be too narrow, improperly formed, or unable to close completely. Some conditions involve abnormal connections between blood vessels or malformations of major arteries. Because blood flow is altered, the heart often has to work harder to deliver enough oxygen to the body. In infants, this may cause rapid breathing, poor feeding, slow weight gain, or a bluish tint to the skin caused by low oxygen levels. In milder cases, symptoms may not appear until childhood or adulthood, when exercise intolerance, fatigue, or shortness of breath becomes noticeable. The causes of congenital heart disease include genetic mutations, chromosomal abnormalities, maternal infections, certain medications, and uncontrolled medical conditions during pregnancy. Advances in diagnosis and treatment have allowed many people with congenital heart disease to survive into adulthood, but long-term monitoring is often required due to ongoing strain on the heart. Endocarditis is an infection of the inner lining of the heart, known as the endocardium, and most commonly affects the heart valves. The condition occurs when bacteria, fungi, or other microorganisms enter the bloodstream and attach to damaged areas of the heart. Once attached, these organisms multiply and form infected clumps called vegetations. Microorganisms usually enter the bloodstream through everyday activities such as dental procedures, skin infections, intravenous drug use, or medical devices like catheters. In a healthy heart, these organisms are typically cleared without causing harm. However, people with damaged heart valves, artificial valves, congenital heart defects, or prior heart surgery are at much higher risk because irregular surfaces make it easier for organisms to attach. As the infection progresses, vegetations can damage heart valves, preventing them from opening or closing properly. This disrupts blood flow and can lead to heart failure. Pieces of infected material can also break off and travel through the bloodstream. If these fragments block blood vessels in the brain, kidneys, lungs, or other organs, they can cause strokes, organ damage, or life-threatening infections. Symptoms often develop gradually and may include fever, chills, fatigue, shortness of breath, heart murmurs, and unexplained weight loss. Without prompt treatment, endocarditis can cause severe valve destruction, systemic infection, and fatal complications. Myocarditis is a condition in which the heart muscle, called the myocardium, becomes inflamed. This inflammation interferes with the heart's ability to contract and pump blood effectively. The condition can be mild and resolve on its own, or it can be severe and rapidly life-threatening. The most common cause of myocarditis is a viral infection. Viruses such as those that cause respiratory or gastrointestinal illness can enter heart muscle cells and trigger an immune response. In some cases, the immune system continues attacking the heart even after the infection has cleared, prolonging inflammation and damage. Myocarditis can also be caused by bacterial infections, autoimmune diseases, toxins, certain medications, or allergic reactions. Inflammation damages heart muscle cells and disrupts the heart's electrical signaling. This can weaken the heart's pumping ability and cause abnormal heart rhythms. As pumping efficiency declines, blood may back up into the lungs or body tissues, producing symptoms similar to heart failure. Symptoms vary widely and may include chest pain, shortness of breath, fatigue, palpitations, and fainting. Some individuals experience flu-like symptoms before heart symptoms appear. In severe cases, myocarditis can lead to sudden cardiac arrest, severe heart failure, or the need for mechanical heart support. Recovery depends on the cause and severity of inflammation. Some people recover fully, while others develop permanent heart muscle damage. Pericarditis is inflammation of the pericardium, the thin two-layered sac that surrounds the heart. The pericardium helps anchor the heart in place, reduces friction as the heart beats, and provides a protective barrier against infection. When this sac becomes inflamed, normal heart movement is disrupted. The most common cause of pericarditis is a viral infection, but it can also result from bacterial infections, autoimmune diseases, chest trauma, heart attacks, kidney failure, cancer, or reactions to certain medications. In some cases, no clear cause is identified. Inflammation causes the pericardial layers to rub against each other, producing sharp chest pain that often worsens with deep breathing, coughing, or lying flat. Sitting up or leaning forward may reduce pain by decreasing pressure on the inflamed tissue. The inflammation can also cause fluid to accumulate between the layers, a condition known as pericardial effusion. If fluid builds up rapidly or in large amounts, it can compress the heart and limit its ability to fill with blood. This life-threatening complication is called cardiac tamponade. Reduced filling leads to a sudden drop in blood output, causing low blood pressure, shock, and organ failure if not treated promptly. Pericarditis may be acute, lasting days to weeks, or chronic, with recurring episodes that cause long-term discomfort and impaired heart function.